An external ventricular drain, or EVD, is a temporary, life-saving plumbing system for the brain. It's a critical tool used in neurocritical care, especially for patients with brain injuries, bleeding or swelling that threaten to increase pressure inside the skull. The EVD is a thin, flexible tube placed by a neurosurgeon directly into the brain's ventricles. Its main job is to drain excess cerebrospinal fluid, or CSF, and relieve dangerous pressure that can quickly become life-threatening if not managed. The system relies on gravity. The drainage chamber's height, carefully set relative to the patient's ear, determines exactly how much fluid is removed. This precise adjustment is essential for safe and effective treatment. EVDs serve a dual purpose. They both monitor and treat high intracranial pressure, helping to protect the brain from further injury and allowing the care team to respond quickly to changes. Nurses are the guardians of this system. Your vigilance in setup, monitoring, and infection prevention is critical. Every step from checking connections to maintaining sterility matters. Even small errors can have major consequences for neurological recovery. A lapse in attention or technique can lead to infection, bleeding, or permanent brain damage. Mastering the basics of EVD physics and anatomy is the foundation for safe, effective care. Understanding how the system works empowers you to act confidently in critical moments. Your attention to detail, knowledge, and commitment can truly mean the difference between a patient's recovery and irreversible harm. EVDs are used when pressure or fluid builds up dangerously in the brain, threatening vital brain function and patient safety. Common reasons include hydrocephalus, excess CSF, severe traumatic brain injury, and subarachnoid hemorrhage from a ruptured aneurysm, all of which can rapidly increase intracranial pressure. EVDs drain fluid, monitor pressure, and can even deliver medication directly into the brain's ventricles, providing both treatment and essential monitoring. They're also used after major brain surgery or for severe infections like meningitis, helping manage swelling, remove infected CSF, and support recovery. In these critical and often life-threatening situations, EVDs can truly be the difference between life, death, or permanent disability for the patient. External ventricular drains, or EVDs, are life-saving devices that play a crucial role in controlling dangerous increases in brain pressure for critically ill patients. They provide real-time data, allowing the healthcare team to make urgent, informed decisions that can mean the difference between recovery and decline. EVDs also enable the collection of cerebrospinal fluid for laboratory analysis, helping to diagnose infections or other neurological conditions quickly. Additionally, they allow for the direct delivery of medication into the brain's ventricles, bypassing the blood-brain barrier for targeted treatment. This versatility makes EVDs indispensable in neurocritical care, supporting both monitoring and intervention. However, the risks are significant, most notably infection, which is the most feared complication since the EVD creates a direct pathway into the brain. That's why strict aseptic technique is absolutely essential. Every single interaction with the EVD carries a potential risk for introducing bacteria. Other dangers include bleeding during insertion, accidental catheter blockage, and the possibility of blood entering the drainage system. Overdrainage is another concern, as it can lead to brain injury or sudden neurological changes if not carefully monitored. Balancing effective drainage with patient safety is a constant, delicate challenge for the care team. Your vigilance, attention to detail, and clinical skill are the best defense against these potentially life-threatening complications. EVDs are powerful tools in neurocritical care, but their safety depends entirely on the quality and consistency of the care they receive. As a nurse, you're the frontline protector of patients with EVDs, playing a crucial role in their safety and recovery every single shift. Always check that the transducer is level with the patient's ear. Incorrect setup can lead to dangerous errors in pressure readings, which may impact patient outcomes. Monitor neurological status and CSF output closely. Sudden changes in fluid color, clarity, or volume are red flags that could signal infection, blockage, or bleeding. Use strict aseptic technique for every interaction, from sampling to changing dressings, to minimize the risk of introducing infection into the central nervous system. Keep the insertion site clean and dry, and follow your hospital's EVD protocol without exception. Consistency is key to preventing complications. If drainage stops or the ICP waveform flattens, systematically check the system for kinks, blockages or disconnections, and escalate concerns immediately to the medical team. Your ability to troubleshoot and act quickly is vital for patient safety, especially in high-pressure situations where every second counts. With vigilance, expertise, and compassionate care, you can prevent harm, support the best possible recovery, and make a lasting difference in your patients' lives.